The United Nations Children's Fund, UNICEF, has urged the 5 Southeast governors to prioritize the provision of sanitation infrastructures in their states. This is as the organization noted that Ebonyi and Enugu states have the highest number of persons still practicing open defecation in the zone. The health specialist representing the Chief of Field Office, UNICEF Enugu Oluseji Akinleye, revealed this on Tuesday during a media dialogue to mark the 2024 World Toilet Day (WTD) in Enugu. Akinleye said that following such sanitation infrastructures like public toilets will help in promoting healthy environment and asked them to make adequate budgetary allocation for sanitation.
In commemorating this year's campaign, UNICEF would like to highlight 3 key messages. 1. Toilets are indeed a place for peace. This essential space is at the center of our lives, and it should be safe and secure. But for billions of people, sanitation is under threat from conflict, from climate change, from disasters, and from absolute individual, societal, and government neglect. Toilets are a place for protection. By creating a barrier between us and our wastes, sanitation services are essential for public and environmental health. But when toilet systems are inadequate, damaged or broken, pollution spreads and deadly diseases get unleashed. 3. Toilets are a place for progress. Sanitation is a human right.
According to him, the World Toilet Day is celebrated annually to raise awareness about people living without access to safe toilets and to accelerate action to tackle the global sanitation crisis by 2030. The health specialist disclosed that 73% and 43% of people in Ebonyi and Enugu states, respectively, still practice open defecation.
Annual funding needed for ODF is approximately 168 billion naira. That's the annual budget required for ODF in Nigeria. It's about 168 billion naira. But only 15 billion was invested, not in 1 year, between 2018 to 2022, a period of 5 years. So that is also one of the bottlenecks to achieving ODF and ensuring that sanitation, goes around all our communities.
Also, the WASH specialist with UNICEF's Enugu office, Rebecca Gabriel, emphasized the importance of collective action to address the sanitation crisis.
When toilet systems that we're talking about today now, when they are inadequate or they are damaged or they are broken, they spread pollution and they also spread deadly diseases. Deadly diseases from cholera, from diarrhea, and we all know that children are greatly affected. If you talk about one of the major cause of deaths in under 5, children under the age of 5, are talking about diarrhea. Diarrhea is one leading cause of death for children under the age of 5. And this is something that is a result of polluted or contaminated water. Polluted water, and what is the source of that pollution? It is feces.
She urged governments and private individuals to increase investments in sanitation infrastructure, especially in public places such as schools and markets.